You commonly hear pregnant women say, "I'm eating for two." Now, eating enough of the right food is obviously a good thing to do when you're pregnant. But what if a pregnant woman says, "I'm drinking for two"? What would you think about that? Hello, I'm Julie McCrossan. And if you're thinking that having a drink or two while you're pregnant does no harm to your baby, listen up. Fetal Alcohol Spectrum Disorder, or FASD, is a group of disorders caused by drinking alcohol during pregnancy. Babies can suffer lifelong physical and intellectual disabilities because of it.
In hearing that now, you do, I do think, maybe I have done the wrong thing.
It was just sort of known within the group of friends that we were with, I suppose, that you just didn't drink while you were pregnant. It's the best thing for the baby.
I understand that there's some belief that a few drinks is okay as long as it's not on a regular basis and as long as it's not too much.
The condition is not curable and the damage is permanent, but it is preventable. Sometimes when a baby with this condition is born, you can't even tell that anything is wrong. But in fact, there may be brain damage causing lower intelligence and behavioural problems that may only become obvious later in your child's life. But sometimes alcohol during pregnancy can cause physical abnormalities and stunted growth. So is it safe to drink at all when you're pregnant? To help answer this question, we spoke to people with this problem, their families and specialists on a recent panel discussion with Dr. Norman Swan.
Why do you think it is that GPs are not good at recognising this?
In my case, when I went through medical school, there was no training on fetal alcohol syndrome, and I think a lot of GPs are reluctant to diagnose or not even to think about the issue.
I can talk longer.
Crystal, whose mother was an alcoholic, went to live with her grandparents Greg and Margaret. Sadly, her grandmother died a few months before we visited the family. Now her grandfather is raising her alone.
Crystal is a very energetic little girl who's pretty well outgoing, and she's normally a very happy little girl. I'm Crystal's grandfather, but she treats me as her father, her new dad. Crystal is now 7 years of age. When she first came here, she was 4 years of age. She was an exceptionally shy little girl, but over the time she's been here, with the help of Margaret mainly, she became much friendlier and lost that inhibition to make friends, etc. Crystal's mother, unfortunately, is an alcoholic, and she wasn't taking care of Crystal, neither was her father, and Crystal was removed from her, and that's why we applied for custody of Crystal. I don't think Crystal is a severe example of fetal alcohol syndrome as far as features. I'm more worried about her mental capacity and in later life her behavioural problems. Give her a kick. As a baby, Crystal was a little bit backward. She was born with a heart murmur. She also bruised very easily, and she was underweight and also a very small child. Crystal had squint in both eyes. She had 3 operations to correct that, but I don't think they actually realised there was anything else wrong with her. We picked up that she had fetal alcohol syndrome through a psychiatrist who identified certain symptoms and pointed them out to us. Crystal at that stage was 5 years of age.
Nose.
Margaret had noticed her little fingers being crooked. I don't think she'd noticed the other features. I think there's something to do with the lips, and I think there's something to do with the forehead too.
And we went through these words yesterday?
She had been seen by a psychologist before who had assessed her as having a very low mental capacity in the bottom 10% of children.
Those.
Goes.
Dr. Sarah Williams diagnosed Crystal. She'd also seen Crystal's mother on the same day, which I think confirmed the alcoholism. And when she referred us to Professor Elizabeth Elliott, the professor also confirmed from what she knew and what she observed that Crystal was a fetal alcohol syndrome child. even though she presented with normal weight and normal height for a child of her age, which actually did surprise the professor. Fetal alcohol syndrome mainly comes out, I think, in her learning capacity, her behavioural problems, and lack of concentration.
E, what's your word there? O-V-E-R. Over. Say it.
Crystal is not doing real well at school. She's definitely in the lower percentage of the kids at school. She's had to repeat kindergarten. This year in first class she's struggling, has problems with homework. The school has mentioned that she wants to do things her own little way.
Now read this one. This is a fish.
And tends to wander off, and also get on the tables or chairs, things like that. That's where I think she's a lot different to other children.
Crystal!
I think what it is that she doesn't respond as quickly as most kids.
Crystal!
She tends to ignore you to a reasonable amount. You might have to repeat something 2 or 3 or 4 times. This diagnosis certainly has been a very, very helpful thing for us. It did explain a lot what was wrong with her, and it certainly has helped us to get extra help for Crystal at school, because funding for special education is very hard to get, and the special teacher used this information to obtain this funding and continual funding, and also it enlightened the school, the teachers, and they have also taken a little bit extra care of Crystal. She always will struggle with education. She certainly will never be a brain surgeon.
Crystal, don't be a show-off.
I'm not.
Get down from there.
We're trying to overcome a lot of the behavioural problems by giving her a lot of rest, because she gets very excited, and when she's playing she tends to play very hard. Like skipping, she'll skip. She wants to ride a push bike, she rides the push bike like anything. You have to then start quieting her down, because when she gets tired she gets overstimulated and starts to become a bit of a handful. That's the time to get her into bed as quickly as possible, because she becomes hyperactive.
Is it up there?
Crystal's future, I think, is up in the air. I don't know what's going to really happen to her.
I'm gonna climb up the big one.
I am worried about her future, especially if I'm not around in later times. It depends upon me to a great extent, how long I can look after her and what other support is given to her. I'm hoping that I'll be around until she's well into her 20s. I don't know what will happen with her, because she needs that, special care and a lot of loving care. She's a child who gives a lot of love, but needs a lot of love and a lot of support.
Crystal is lucky to have a grandfather who understands her special needs. Many other children are not so fortunate. Their parents or carers may not even understand why they're being disobedient or disruptive. What these children need most of all is diagnosis and support. Professor Elizabeth Elliott, the paediatrician who diagnosed Crystal, is passionate about raising awareness of fetal alcohol spectrum disorder among health professionals and the community.
How are you today, Jordan?
In my opinion, fetal alcohol spectrum disorder is underdiagnosed in pregnancy. We have good information from our health professional surveys that doctors and nurses are not asking about alcohol use in pregnancy, and that they don't know how to make the diagnosis. They don't know what are the features. Alcohol in pregnancy has a range of adverse effects. At the severe end is fetal alcohol syndrome, which is characterised by birth defects and an abnormal face, characterised by a flat mid-face, small eye openings, and sometimes a small head. And in addition, alcohol can cause a range of other neurodevelopmental problems. These include abnormal sexual behaviour, learning difficulties, attention problems, hyperactivity, and a whole range of emotional and mental health problems. Fetal alcohol syndrome was not described till about 1973 and has not yet found its way into medical school and other health professional curricula.
Can I get you to write your name there?
Doctors and nurses say they don't know what to do with these children if they make a diagnosis. They're frightened of stigmatising families and children by labelling them with this diagnosis.
There are higher rates of this problem in Aboriginal and Torres Strait Islander communities Australia-wide. Lorian Hayes has spent the past 5 years working with people in Aboriginal communities in Queensland. She runs workshops from Brisbane to Cape York, talking about the effects of alcohol on unborn babies.
And they're the signs of fetal alcohol syndrome. And it will have developmental problems, it may have brain damage and short-term memory loss as well. So
Lorian herself has a 34-year-old daughter with suspected fetal alcohol syndrome.
I wasn't an alcoholic. I only drank like 2 or 3 drinks at a wedding or at a 21st or something, and it was creme de menthe lemonade, which is a liqueur, and that's why I'm very advocate strongly about no amount of alcohol is safe. You don't have to be an alcoholic and drink more than 7 drinks to do damage. And I also have 21 members in my extended family with suspected FAS.
21?
That's right. So it's a huge issue.
And sometimes, like you were saying before, Taylor, the parents might have fetal alcohol syndrome. Do you think that's a possible thing? It's so important we target young people and educate them about the dangers of drinking and drinking if they're pregnant. It's primary prevention that we need to educate young people, like nipping it in the bud before it starts. And this is a little chicken, and you can see the chicken's got birth defects as well, caused from the alcohol that was injected into the egg. I think they're quite shocked that alcohol can do so much damage. They can't see the damage that it does internally, and I think that's the benefit of the program, is that it actually is quite visual and they come away with more knowledge, and it's like throwing a stone in the pond. We're creating lots of ripples, you know, and they will go away and talk to someone else about it, so the message is getting out. They have poor bonding or failure to thrive. They have problems with their behaviour and their learning, and they'll have problems also with fine motor skills. Aboriginal women are vulnerable for many reasons, especially when their life is bound up with the use of alcohol. You know, you may not drink alcohol yourself, but there'll be someone in your immediate family or extended family that does, and it has an impact on everyone in the family. This fetus has the same peak blood alcohol level as the mother. So whatever she drinks, it drinks. There is no safe level of alcohol you can consume during pregnancy. No amount of alcohol is safe. If you're pregnant, you stop drinking. It's like playing Russian roulette. At any stage or through your developmental stages of pregnancy, if you're drinking alcohol, you run the risk of having a child with FAS. So the reasons for drinking are people in the community have told me. We run workshops for older women, and it's like a release. It's like putting the last piece of the jigsaw in the puzzle.
Yeah. So Lauren, a lot of these kids who are born with fetal alcohol syndrome, not all of them have got the facial features?
That's true, Marlene. A lot of them say, well, look, I drank with her and they're all right, look at them. You know, but those children have severe behavioural problems. They can now understand what's been tormenting those children or youth or adults that are in their family and that they're caring for, because they're quite troubled, some of these kids, with their behavioural problems, and the older women understand that they need now to respond to them in a different way, rather than just thinking that they were bad children or naughty children, but really that they have a medical condition that needs to be diagnosed or looked at. And the mum comes home from hospital and they'll say the baby's got a bad temper and it's screaming all the time and it won't stop crying. And see how it's shaking? It's not angry, it doesn't have a bad temper, it's going through withdrawals for alcohol. We run workshops for men so that they're not blaming the woman and saying it's all her fault that the child's got fetal alcohol syndrome because she drinks, and we don't want to stigmatise that woman or child. If a man's drinking alcohol and his sperm can become damaged from the alcohol, and he can contribute to having a baby that's a low birth weight baby or miscarriage or premature birth. Men have a role to play because they need to support that woman to stop drinking alcohol, even if that means stopping themselves.
They couldn't understand what was wrong with them. I said, no, it's a mental illness, it's a mental disease from their mother was drinking alcohol. Now they suffer from ADHD.
Yes. It's not about blaming, it's about saying, well, this is the problem, this is what's happening, and let's do something to address it, and let's do it together, because you can't do it on your own. FASD isn't an Aboriginal problem, it certainly isn't. It affects every race of people and every socio-economic level of people in the world. If you're sexually active, you drink alcohol and have unprotected sex, you run the risk of having a child with this disorder.
Our community pretty much accepts that smoking harms unborn babies, and we place warnings on cigarette packets. Our next challenge is getting people to realise that alcohol can be just as harmful. This young man was in his mid-teens when he was diagnosed with FASD.
My name's Seth. I live in Mackay, and my girlfriend and I just got our own place now and doing quite well.
When I was pregnant with my second son, Seth, I started taking vitamins, I stopped smoking when I found I was pregnant. But I didn't know, and nobody told me that, and it was in none of the books I read either, that alcohol was harmful. I drank no more, no less than other people I'd seen pregnant. I thought it was completely fine. He was a beautiful baby. He had an APGAR score of 10. He thrived. But 12, 13 years of age, he became just completely unruly. He was into drugs, alcohol, sex. We were a loving, caring family, and I know that teenagers are troubled, but this was something very different. Interspersed with this were some very bizarre behaviours. He was suicidal daily, very, very troubled. We found a noose and ladder in the shed. I want to die on all his furniture in Nico pen, he'd written it. I just thought that we would never see him live through those teenage years.
If I'm not taking my medication, like I'll tend to snap a lot easier than I would if I was taking my medication. It makes me concentrate a bit more and it settles me down a little.
When Seth doesn't take his medication, I think probably the most common thing we start seeing, his mood will drop very dramatically within the first day.
Sometimes I can go overboard and just start yelling at people, and sometimes for no reason at all. I don't concentrate as much, like I could just be sitting here thinking that I'm listening and I'm not actually listening to anyone, you know, like sort of selective hearing sort of thing.
His moods are a lot more heightened towards anger and things like that when he isn't on his medication.
The medication is an antipsychotic, and it stops him from becoming paranoid and stops him from becoming violent. That medication has just been so valuable. I'm sure Seth would be in prison by now if he hadn't had that medication.
Come on.
Quick. It was very difficult to get a diagnosis in Australia, and every doctor I went to didn't help me. Didn't know what was wrong with him, diagnosed him with ADHD, all of those things. I was absolutely desperate. Seth was desperate. He didn't know what was happening to him. And I must say that when he found out what was wrong with him, he was as happy as I was distraught, because at least he had a reason for why he was doing the things he was doing.
When the tide's out, you can walk from the creek.
Back when I was a bit younger, when that used to happen, I didn't know what was going on. Like, I knew I was angry at something, I didn't know why or anything. And it is better to know that why it's happening.
You can see from Slow Point.
Anybody with FAS finds it difficult to understand cause and consequence. So when Seth gets money, he doesn't necessarily understand that the bills have to be paid. He could just go and spend the money.
Yeah, how you going? I'm just inquiring about the courtesy bus driver's position.
Employment is very, very difficult for Seth. Given that he's got very good verbal expression, he can easily get a job. At first meeting you wouldn't realise that there was any difference to any other person, but if you gave Seth instructions, for instance, he might only understand the first one. So in a work situation you couldn't give Seth half a dozen verbal instructions. Go and sweep the floor, then do this, then do this, then do that. That wouldn't work for him.
They just think that I'm a normal person, that I can do these things and that it's easy. Where in fact it's actually, you know, a little bit harder. And
even though he's 22 years old, often he can still behave like a 13 or 14-year-old.
The motor shop. Yeah, it's buggered.
Seth has a very good IQ, but it's his executive functioning that's compromised through this condition, and that's social interactions and judgment.
Maybe if we raise the gargoyle up so he sprays it straight into the pond.
The difficulty Seth will face are financial, holding down a job for any length of time without support. He needs that support. Managing his affairs, attending to mail, responding to appointments.
Seth is actually getting a little bit of help with managing his financial side of things. He has public trustee helping him with paying a lot of his bills. We do still get some bills sent to us, just a couple to help us get underway with that, and I help Seth just with basically letting him know the bills are there. I'll remind him that they need to be paid. But we shouldn't be paying rent on the phone, should we? Constant reminding is probably one of the other things that helps him a lot. I mean, if I didn't do it, I couldn't honestly see him remembering most of his appointments or things like that.
My husband and I moved to Cairns because of my job, but Seth and Hayley didn't want to leave. I was very worried because I wanted to test to see if Seth could live independently, but I wanted to do it with a lot of buffers around him. He and Hayley are living in their house. They pay a little bit of rent, which covers electricity and various things. So they're independent, but they're not.
I want a happy life. I want a family, you know, a nice house and a job, good secure job that I can stay in.
Thankfully now, he's got the support of a disability employment service, which provide him with support during his work.
Yeah, I got some on-job help by a place called Pioneer Employment Service. They help me out with all my employers and some of the staff if I'm having problems with them and things. They'll come out on site and help me out with them. Instead of me blowing my top, they help get me through it calmly.
Sterling Claren coined the term external brain, that a person with FAS needs to have an external brain. With Hayley's help, that should be okay, but it's a burden for Hayley.
I try to help Seth out as much as I can without taking away his responsibility. I mean, other things I help him with a lot are definitely his communication with other people like friends, workmates. He does have problems here and there, and a lot of friends don't know about fetal alcohol syndrome with him.
You just don't want your baby or your kid going through what I've been through in my life. It's not good, it's not healthy. So I'd say just stay off the alcohol when you're pregnant.
The latest research shows that up to 47% of Australian women currently drink while they're pregnant. And it's important to realise this problem, fetal alcohol spectrum disorder, can happen to anyone, including older, educated, more affluent women whose drinking habits are already entrenched.
I guess it was just something I was used to, and it was part of the culture I'd been brought up in. It was probably more at those social events, if people were around for dinner or, we were out or something like that.
Socially, we tend to have 1 or 2 drinks a week, and that's fine, and so you don't seem to think so much that that's excessive drinking. You think of binge drinking as being excessive drinking, whereas there's a lot, obviously, in alcohol that can pass through the placenta just as there is in cigarette smoke or in other drugs.
We know that if you drink, you may have a child with FASD. So if you're thinking of having a baby, making a choice not to drink at all seems like a sensible thing to do. And if you'd like more information on fetal alcohol spectrum disorder, visit the Rural Health Education Foundation website at rhef.com.au.